You may not know, but you sure might feel it this holiday season. This weekend wraps up GERD Awareness Week. GERD stands for gastroesophageal reflux disease. It's a condition where stomach contents flow back into the esophagus. The most common symptom is heartburn, and it is common over the holidays. So how do we prevent it? Dr. Trip Buckley with Baylor, Scott and White joins us today. And first, Dr. Buckley, let's just talk about the symptoms. How do you know that potentially you're suffering from this?
Well, certainly, GERD stands for gastroesophageal reflux disease, like you said, and the most common symptom is heartburn, so that burning pain that you get in your chest, and maybe after you've eaten a heavy meal or something like that. So that kind of gnawing, burning pain is the most common symptom. Certainly, regurgitation of food contents up into your esophagus from your stomach, maybe difficulty swallowing, belching, sour taste in your mouth, those types of things.
All right, and we're eating a lot this time of year, so what are some tips to reduce some of these symptoms?
You bet. Well, first of all, we want to avoid trigger foods or substances that can actually cause GERD that reduce the tone and the sphincter between your esophagus and your stomach. Those are caffeine, alcohol, tobacco, peppermint actually causes some of those things. Other things to avoid are heavy foods, spicy foods, so things that are not going to transit through your stomach very quickly. So overeating in the holidays is the big problem, and then try not to lie down immediately after eating. That way you won't get the reflux feeling.
So just be careful before you go for that extra slice of pie.
Exactly.
And you also brought a little show and tell for us today?
Oh yeah, sure. This is actually a magnetic sphincter that we can place surgically for folks that have terrible GERD, surgically correctable form of reflux, and that is a minority of patients. But when the medications aren't working, or when you're on lifelong medications or actually have damage to your esophagus, surgery could be a good option for you. And at the Baylor Scott and White Heartburn and Acid Reflux Center there in Round Rock, we have a comprehensive team designed to take care of those complex GERD patients.
Okay, and real quick, is there an age group or a demographic prime target for suffering from this?
Typically, we think about older folks starting to have these problems, and I say older folks, I guess I'm in that category, 40 to 50, but we're really starting to treat patients as low as the teens, 20s, patients that are going to be on lifelong medication. That's where we really need to think about trying to look at lifestyle modifications to stop GERD and control the symptoms. So it can be really anywhere in any age group.
All right, so enjoy the holidays, but also keep your health in mind. Dr. Buckley, thank you.